So my name is Gerard Cox. I work here at the Firestone Institute for Respiratory Health in respiratory medicine with a specific interest in pulmonary fibrosis. A clinical trial is a research experiment in people where the impact of an intervention, usually a drug treatment, but not always, is examined to see whether it changes the natural history of disease. In pulmonary fibrosis, this really comes down to testing new products that are being developed for pulmonary fibrosis. In a clinical trial, the classical design is that there are two groups that are equal in every factor and element and description of their disease. One group receives the active treatment and the other does not. When outcomes are assessed over time, we're able to see whether the active treatment changes, and we hope for the better, any of the outcomes that we measure that indicate the disease being present and progressing. The drugs that are used, in the past we've examined drugs that were anti-inflammatory and found that they're not terribly effective for treating pulmonary fibrosis. And now we're examining drugs that interfere with the process of scar tissue or fibrous tissue being formed. So these are anti-fibrotic drugs. They prevent fibrosis from forming. And there are a number of different products being developed and being examined. From the point of view of the patient, we need therapies. We need more therapies than we have now. We're only going to find out what works by doing trials. So participating, it may not help you, but it'll certainly help us understand what's better or more effective for treating this disease in the future. And if you are in a clinical trial and you receive an effective therapy, well then you've received it before anybody else got it and before it's available to the general public. The final benefit, or another benefit, of taking part in clinical trials are that we watch people very closely and carefully while they're involved in a trial. We're very keen that they get the best possible care and that we don't do them any harm. This means that we have extra staff available that are more responsive and easier to get to than us doctors are usually, and they have a ready access to us if our attention is needed to take care of something that's going wrong. So being a part of a clinical trial gives you more intensive supervision and more rapid access to care than usual.